today I really want to talk about digital health infrastructure. And the reason I want to talk about that is because, I was just recently at UNGA week last week, and everybody was talking about UHC. And really, to achieve universal healthcare, you need data. You need to know where patients are, where they're moving, who needs care. Be proactive about the care that's being provided and what resources are needed to provide that care. And to really look at what we can do to improve the quality of care that's being provided, especially when we're talking about rural or low resource settings. Being able to have a flow of information that's saying this is what's happening in this really rural area or at the last mile of health, and this is what they need, and this is the information and support, and there's not months and months going by before that information gets to a decision maker. But one of the challenges that exists is, right, like we know the technology is there, right? Like the technology we need to do a lot of these things has been around for decades, if not longer. But the governance around the systems that are needed, the political will, the financial support is not there, and it's very much a broken system. So for my talk today, I'm going to give a kind of an overview of what digital public infrastructure is. It's coming up more and more. DPI, the major funding organizations are supporting it. WHO has included it as part of their global digital health initiative. So you'll see, if you haven't heard DPI a lot, you will start to hear it a lot if you're in the digital health space. Then in particular, I want to talk about digital public infrastructure for health. Which is going to be its own component of DPI. Some of the challenges we're facing in this space, and then leave the group with kind of a call to action. So what's digital public infrastructure? So it's really looking at, like, what are the core kind of services that are needed, right? So there's infrastructure just generally that's needed in a country. Do you have 5G services throughout the country? Is everybody able to somehow get on the internet in some way, right? Do they even have basic access? Are the cell phone towers in place? And we know that's not the case in many countries. It's not the case in my own country. I think people are sometimes surprised that the U.S. is a big country, and there are actually infrastructure shortages throughout the country. And then what are kind of the core services you needed? So generally, when people talk about DPI, they talk about three core services. One is identity management, right? Who are you as a person within the country? One of the things, and this is my own soapbox, that I feel like I'm a lone person saying this, so don't repeat it as like this is what people say about identity management, because this is only what Olivia says. A lot of people talk about citizen health. Your identity as a person should not be in relation to the state, right? Once you cross into a border of a country, you're that country's responsibility. If you have COVID, if you have some other infectious disease, it does not care about your relationship to the state. So your identity as a person shouldn't matter with your state identity. But that's my own sidebar. But generally, identity management. The next is digital payments. So being able to share and process payments, being able to send money. You always see Kenya and M-Pesa as the shining example of how digital payment systems, transform the local economy. So think of things like that. Any kind of way to transmit payments, particularly for people who were previously unbanked, right? So we know most of the world's population actually doesn't have access to bank, doesn't have access to credit. So having access to a way to send and share money without a traditional bank or traditional banking model is critically important to advancing any economy. And then finally, overall, looking at data exchange, how data flows throughout the system, who needs those data, and who can get them. So that's kind of like the very basic, this is what DPI is. There's other things around it. Obviously you want privacy and security and things that are going to feed into that, but these are kind of the core components. So right now I'm calling this DPI for health. I don't I don't think there's really like a formal name for it yet, though I think it's coming and people are talking about it more. But really looking at what are the core systems that we need in the provision of health along the spectrum from individual health to family health to community health to population health, right? To really like when we're talking about UHC, here is all the information we need to make UHC happen. So, yes, we still want identity management, but we want identity management that protects patients' rights and autonomy, and also recognizes the interconnectedness. So, I'm sorry that I didn't give my background earlier, but so I was a software developer. I went to nursing school, and my focus for many years was maternal and child health and adolescent medicine, right? So coming from a maternal health perspective, right? Health is given in a dyad. Your relationship, your mother to child, mother to newborn within a family, right? There's interconnectedness there that in order to improve health outcomes within family units, you need to understand how people are connected. So the other thing is, right, like payment, right? So if your country has a national insurance scheme, how are the mechanisms in place to help facilitate payment through insurance, through individual payments, through self-funded payments, through private insurance, and all the kind of tricky mechanisms about however payments may work around healthcare within a given context. And in every place it's different, and every place it's complicated, right? So those are some core things related to what we think of as traditional DPIs, and then obviously the data exchange is a big component. Um, but I want to talk a little bit about OpenHIE. So OpenHIE stands for Health Information Exchange. And if you're not familiar with health information exchange, it's the concept of what I just previously talked about. It's like all the data you need to exchange to provide care across the full life spectrum of community and people in different kinds of populations, right? And OpenHIE itself is an actual organization. You can go to their website. I think it's openhie.org. And hopefully maybe somebody can find it and drop it in the chat. But they've been around for a couple decades, I think. And they've been helping countries to implement health information exchange and health information exchange architecture. And it's evolved a lot. And as you can see here, there's a few components to it. So at the bottom, we have point of care systems, so community health systems, electronic medical records. These are the systems you may, as a patient or a person, be more likely to interact with, right? And then the things up in the blue box are kind of the registry services and the business domain services. So a registry service or like some of the things I talked about IntraHealth tools like a health worker registry, which Iris is, a facility registry, which Gopher is, and a client registry, which is OpenCR. Terminology services is, if you're not aware of what that is, it's a much longer topic than I'm going to explain here, but it allows me to know, right, this medical term means this no matter what system it's in, right? Like we're talking about the same thing. That's interoperability and standards. I don't have time to go into that. And same thing with a product catalog. These are all the products and you can pull from them. And the idea is that if I have an EHR, it's pulling from the same facility system. And if I have a lab system, it's pulling from that same facility system. So it's sharing all that data and information, and there's a standard to how that information is used. So I know this lab system and this EMR are both talking about the same facility. And that the information about that facility is maintained and updated. So within a facility registry, you'll have all these kind of standard components about what information you track, the location of the facility, the name of the facility, what services are offered in that facility, what's the status of that facility. Is it still offering services? Did it stop being able to do something because it's out of a particular commodity? Like it can expand into a lot of areas. So what I want to talk about is like the OpenHAE kind of started organically because you had different organizations that were developing open source tools with the idea of supporting public health in underserved communities and underserved settings. So, like I said previously, IntraHealth, we had a USAID cooperative agreement to do health workforce capacity building, and as a part of that, we developed IRIS. We made that open source so people can access it. And then as different communities came together, there's open source EMRs, there's a number of those, the client registries, there's a number. We're not the only client registry tool, we're not the only facility registry tool, but these groups came together and said, hey, we should all be a part of this architecture to facilitate information exchange. So people worked on the interoperability layer to help map these things together using FHIR standards, which is an HL7 interoperability standard that, again, I don't have enough time to go into today. But the idea in theory is all these things can work together to exchange data. And so what the challenge is that, like I mentioned, just like IRIS was developed under a flagship USAID project, most of the tools that were originally part of OpenHIE were developed under some kind of donor cooperative agreement, whether it was from USAID or CETA or DFID or PEPFAR. And then with no thought of software development never ends, right? It's a thing that goes on and on and on and on and on. And that's not the way most donor organizations work. They want to give you money and then they want you to be independent. But it's really difficult to continue to develop software and to get income to support it when you're trying to provide it as a public good. But these things are critical if we're talking about achieving UHC and talking about getting data across the ecosystem of the healthcare system. And Comfort, I apologize if you need to ping me. I can't see how long I've been talking. Just wave at me when I'm running out of time. But so we want to look at how to maintain and sustain these tools. And then from those of you that are coming from the perspective of a startup organization, here's kind of my thinking about how this fits, right? Say you are a telemedicine startup. And we know it takes a lot of coding and it takes a lot of effort to start any kind of company. Now imagine if there's an open source resource where you can verify patient's identity via client registry, where you can pull facility information of where you're going to refer patients that you're meeting with. And you can also access an open data health worker registry that tells you these are all the providers in the country, both who are working as a part of your telemedicine system, but also who you may refer patients to, right? It lowers the startup costs because you don't have to internally develop those lists. You only have to connect to the API that shares that data. So part of having digital public infrastructure not only benefits the government, and oops, I skipped ahead, the government in how they're able to track their own health data in the system and look across the whole health system, but it also lowers the barrier to entry and the market entry for startups and entrepreneurs who want to contribute to the health space, but who need access to all these kind of data points and information. So one of the things we want to look at, is how do we make this easier? How do we, support innovation and development, but not rebuild the wheel every time? Every time I'm developing a new app, I have to develop a new list of health workers, a new list of patients, and so on and so forth. And then also how we can support that in a manner that's secure, protects special populations, has privacy, and has all the things around it and all the governance around it that we really need as part of the health ecosystem. So, as I said, the challenge is a lot of these tools were developed open source. So, even if we're able to build, and I don't know if I have a comment right, we build all these apps and these cool telemedicine tools and your AI diagnostic tools and whatever, but on the back end, you have this open source platform that has no funding, and two developers that are working to keep it going. That's what's holding everything up right now, right? And this is not stable. This is not a way forward. And this really is going to, in long term, stifle innovation, because eventually my code base will get out of date, the other code bases get out of date, and you're trying to build a cool new tool, and no, I can't work with you anymore, but the government doesn't have the funding or support to upgrade their system. So there's a lot of challenges within the open source community to really like, how do we maintain and integrate and really provide like an ecosystem or a sandbox where innovation can kind of thrive. So with that, I want to, I think I am over time, so I want to skip to a call for action. One is that, you know, we need to collaborate to find sustainable models for digital public infrastructure to help country governments to implement it, to figuring out governance processes so that data can be open and used in both the public and private sector so that everybody can benefit, and ultimately the patients and the people we're trying to serve can benefit by better healthcare, better access to services, and universal healthcare. And we really need advocacy and governance and support for how we get open health data while still protecting the people that we're trying to serve. And so I'll wrap up there. This is my contact information. I'm happy to connect with anyone and to talk about any of this for anyone who's willing to join the conversation.